All, I would like to say thanks to the team of 6th edition of International Conference on Neurology and Brain Disorders for making me this opportunity and giving me this platform to share my views for this paper. So I'm Dr. Priyanka Sethi. I'm a PhD scholar for GD Goenka University, Haryana, India, and I'm also working as an assistant professor for Department of Physiotherapy, Faculty of Allied Health Sciences, Manav Rachna International Institute of Research and Studies, India. So here's the outline for my presentation. So starting with the topic, it's on prevalence and diagnosis of fibromyalgia, a systematic review. So talking about fibromyalgia, it's a chronic disorder which is characterized by widespread musculoskeletal pain with generalized tender points at specific anatomical sites. The classical symptoms which are seen in fibromyalgia, basically it's a chronic pain, fatigue, sleep, anxiety, depression, memory and attention deficits, and mood issues. If I talk about fibromyalgia, it is predominantly seen in females more than in the male population. A few people may likely develop other symptoms such as anxiety, depression, hormonal imbalance, and dysmenorrhea in females, gastroesophageal reflux disease, dry mouth, tachycardia, myalgia, paresthesia, and weight gain are the another presenting complaints. In medical care centers, in the hospital settings, there are few patients with a clinical presentation of fibromyalgia, while in the other non-rheumatological settings like physiotherapy clinics, the reporting of this condition is very rare. Increased sensitivity is reported in the individuals with this diagnosis, and they also complain of adverse side effects of the medications which are recommended by the medical experts. Therefore, the management of this underdiagnosed condition seeks immediate attention and the treatment with the shortest possible recovery as the regular sittings with the doctors affects the patient's mental, physical, and economic status, leading them to stress, attention deficits, and sleep disorders. While understanding the fact that fibromyalgia remains undiagnosed and the treatment is still not clear in all the areas of healthcare. Although the etiology and the pathogenesis of fibromyalgia are still a point of discussion, it has been considered that mental stress or other psychological conditions like depression and insomnia plays a very important role in diagnosis of fibromyalgia. According to research, fibromyalgia worsens the painful sensations by interfering with the brain's processing of pain signals. Since tricyclic antidepressants and selective serotonin reuptake inhibitors have demonstrated extremely good results in the recovery of this condition, it has been thought that the irregularity in the course of serotonin and epinephrine is one of the likely causes to have fibromyalgia. The actual interaction of these drugs and the role of SSRI is still not considered the main cause of fibromyalgia. The anomalies in the brain signals inhibits the busting of sensory pain impulses, leads to increased sensitivity to pain. The increased value of substance P, which is a pain modulator, can also further enhance the sensitivity towards the pain in individuals suffering from fibromyalgia. So there were some another studies which suggest that the autoimmune response can also be the root cause of fibromyalgia, where the presence of interleukin-2 and the cytokines confirms the diagnosis. Further, futuristic studies have been proposed to find out the presence of these interleukin-2 and cytokinins, which are present before the beginning of symptoms of fibromyalgia. In some papers, it has been mentioned that the sleep pattern of the patients with fibromyalgia, the abnormal alpha and the delta sleep activities were recorded as checked on EEG studies. Few studies have revealed that abnormal neuroendocrine levels in the fibromyalgia patients have been seen. The implication of all these findings are still unclear and cannot be considered to be the possible root cause of fibromyalgia. Also, in many studies, the physiological response has been related to the concept of centralization generated from the central nervous system that affects the psychological and the social behavior. Under MRI, abnormal signals were observed in the area compromised of amygdala and thalamus in patients reported for fibromyalgia. So the objective of this study is to find out the prevalence of fibromyalgia in different age groups and genders. Also, the study aimed to find out the most appropriate tool for the diagnosis of fibromyalgia in subjects who experience chronic pain and other associated psychological symptoms like anxiety, depression, fatigue, mood swings, and irritability with its impact on day-to-day activities. So the research gap which has been found that presently fibromyalgia is treated as one or another cause with the chronic pain that is either local, non-widespread or widespread and is treated with the cognitive behavior therapy, pharmacological treatments like NSAIDs, serotonin reuptake inhibitors and the antidepressant therapies and exercises. These therapies has a disadvantage of minimal to no effects, misdiagnosis, expensive treatments, prolonged treatment duration, slow recovery, and less data availability and the side effects of the pharmacological interventions. So the purpose statement is the exact incidence of the disease is yet to get worked out, but a fair incidence has been reported in some literature. Till now, no definite criteria have been laid for the diagnosis of fibromyalgia. As everyone is busy with their busy working lifestyle, each one of us has the symptoms of fibromyalgia, but they remain undiagnosed or misdiagnosed and as treated in one or another way as per the prevailing symptoms. This condition has a relapse and remission course with no proper diagnosis and treatment available till today. So in the study, the methodology was, according to the PRISMA statement, the systematic review was carried out and reported under Prospero with their registration ID, and it has followed all the guidelines which are there for the Prospero registration. We have gone through all the search strategies. We have looked for the eligibility criteria. We have gone with the study selections, data extraction, and the quality assessment. And after that, we have done the data synthesis as well. So starting with the search strategy, before the actual study began, a protocol has been developed according to the PRISMA framework with well-defined objectives and the selection criteria for this project. Coming to my eligibility criteria, inclusion criteria was articles on the fibromyalgia, which includes any of the 3 continents, Asia, Europe, North America were included. Studies and articles were written in English and were freely accessible. Studies or articles which were focusing on the outcomes of interests. Articles were taken from the study of 2011 to 2020. Exclusion criteria, the studies or articles for which the full text is not available or accessible. Studies such as opinions, viewpoints, manuscripts, articles in press, editorials, etc. were excluded. The studies with a duplicity of content were excluded. Studies that were not from the region of interest were excluded, and with intervention and systemic review were excluded. Study selection. So 2 independent reviewers, like that was me, Priyanka Sethi, and my guide, Versa Chaurisia, screened the papers in 4 steps. Firstly, the literature was thoroughly searched in the 3 databases, that was Medline, PubMed, and Scopus, with the help of 5 keywords, that was prevalence of fibromyalgia and dysmenorrhea, fibromyalgia and anxiety, depression, demography, chronic pain and fibromyalgia and gender, and which has given us the results in 646 articles. In the second step, the screening was done at the different levels. Initially, the duplicate studies were removed by using conditional formatting in Excel. The selected articles were reviewed for the screening of papers meeting the study eligibility criteria over the titles of articles. Further screening was conducted based on the understanding of concepts through abstracts, and then eligibility criteria were applied to each abstract. Thirdly, the full text screening was done against the eligibility criteria. So in the last, the studies were included in the review. Data extraction. So these databases are selected only to collect all the published articles from 2011 to 20 that are relevant to the study and may broaden the scope of research. As I said, the keywords were used and the total of 646 articles were extracted, from where the 301 duplicate articles were excluded from the list. The studies has so it is all about the inclusion and exclusion criteria, which we have gone through. So when the further screening was done, a total of 59 articles were included for the review. The full text screening was done against the strict eligibility criteria. So the total number of articles left was 5. The quality assessment. So according to the STROBE guidelines, that is the strengthening of reporting of observation studies in epidemiology, which was used to assess the quality of the observation studies, was utilized by 2 reviewers to evaluate the methodology and procedure in including research papers. The papers are evaluated independently, and according to the STROBE scale, the maximum score for an article is 22. So the following categories were applied, where in the end, all the 5 studies, 5 articles have met with the criteria B. That means they have satisfied to 50 to 80% of the criteria. The data synthesis, we conducted a narrative review on several major components contributing to fibromyalgia that includes age, gender, psychological attributes like anxiety, depression, chronic pain, and women with dysmenorrhea. So result summary, we have worked out the three components that what are the search results, what was the quality assessment, and what was the characteristics of the included studies. So search results says that a total of 345 studies were included under screening process after the duplicity removal. Under all the eligibility criteria for the title and abstract review, 59 papers remained. Finally, 5 studies were included meeting the eligibility criteria in our narrative synthesis after the full text screening. So this was my Prisma flowchart of the inclusive studies. So as I specified that we have 3 softwares, we have 3 database, Medline, PubMed, and Scopus, from where we got the number. And after duplicacy removal, we got 345. So 286 studies were excluded. There were 59 studies that met the full text articles, and there were finally 5 studies which were qualitatively synthesized. So the studies included for the final synthesis for the data synthesis was 5. The characteristics of the included studies and the quality assessment. So what we have done in this, the selected full text review articles were extracted for various parameters such as the first author's name, study title, year of publication, population and outcome measures, findings, so on via Mendeley software. The data was read, understood by the single reviewer in order to import it to the MS Excel and independently verified by the second reviewer. The extracted data from the eligible review articles were analyzed for different outcome measures presented in the form of a characteristic table. All the information such as the title, author, year of publication was thoroughly checked in order to avoid any kind of duplication of data. The latest study meeting all the eligibility criteria was published in 2020 by Adern et al. From Spain. The 2 other studies fulfilling all the criteria and full text available were published in 2017 by W. Aish et al. He was from Germany, and A. Pascal et al. In 2017 Brazil. The 2 studies based on the selected criteria were published in 2015, that was by Wallet et al. From USA, and the Garrett T. Jones in 2015. The 2 studies meeting the eligibility criteria were published in 2013. So the characteristic of all the 5 inclusive studies have been presented in the table. I'll just show you the table in the next slides. So the majority of studies have employed the 1990 ACR criteria, that is American College of Rheumatology criteria, as a baseline evaluation, which was combined with the tender point assessment with tenderness at 11 or more of the 18 particular tender point sites. All of the studies were undertaken with the goal of determining the prevalence of fibromyalgia in a given community-based or a local surveys or people who had already received a diagnosis of condition from the general practitioners. All of the included studies were with the risk of bias as determined by the STRO met criteria B. So this was the quality assessment that has been done with the 22 components, and the final classification comes to B. So these were the characteristics of the table of the included studies. The first study was by Gareth T. Jones that was done. So as I said, that was in 2015. He was from UK, and the study was entitled with the prevalence of fibromyalgia in the general population, a comparison of American College of Rheumatology criteria. He has taken all the criteria, the diagnostic criteria taken to be 1990, 2010, and modified 2010 ACR criteria. The prevalence of fibromyalgia was 1.7% with 95% class intervals, and it was 1.2% and 5.4% respectively for the female to male ratio. The ratio of female to male was 13:7:1, 4.8:1, and 2.3:1. So that shows that female have the more characteristics of fibromyalgia than a male population. Another author, Anne Vincent, has studied under the title Prevalence of Fibromyalgia, a population-based study in Olmsted County, Minnesota, utilizing the Royster Epidemiology Project in 2013. He followed the ACR criteria 2010. It was a retrospective review where he says that 1.1% of the people are having a prevalence of fibromyalgia, where the survey reports for 6.4%. The third study was by Luis Paulo in Brazil, and he studied on a topic worldwide epidemiology of fibromyalgia in 2013. He also used the ACR criteria 2010, where he said the global prevalence of fibromyalgia is 2.7%. Brian Wallet from US worked with the study, the prevalence and characteristics of fibromyalgia in 2012, that is a National Health Interview Survey. He used the modified ACR criteria, and he said the prevalence is in a population with a more than 18 years of age, where the ratio comes to 0.76%, and it is 2.41% in 50 to 59 years aged people. The last study was from Emilia Pascal Marx from Brazil. She studied entitled The Prevalence of Fibromyalgia with the criteria 2010, and they checked for the prevalence in general population. The values comes to 0.2 to 6.6%, where the women in total was 2.4 to 6.8%. The women in urban areas were 0.7 to 11.4%, whereas in the rural areas it was 0.1 to 5.2%. In special population, it was reported to 0.6 to 15%. Coming to the discussion for this, so the purpose of this study was to determine the prevalence of fibromyalgia and its symptoms in participants who had dysmenorrhea. Additionally, this study will aid in the hunt for a more accurate and a valid diagnostic tool so that the healthcare providers can make the right diagnosis and avoid the unnecessary stress that comes with fibromyalgia. We shall attempt to address the goals of our research process in this study. So as all the researchers have specified the associated symptoms with the fibromyalgia, they seek immediate attention to the symptoms like mental stress, depression, fatigue, sleep problems, and mood disorders, and thus provide a better way of living healthy and disease-free. The purpose of the study was determine the frequency and traits of fibromyalgia in general population. So the scientist has used the random sampling to examine 3,006 individuals and found that there were the usual categories of pain with the non-widespread pain and the widespread pain, where 391 more individuals were added and 193 of those were the widespread pain underwent assessments and intervention. The estimated age-adjusted prevalence of fibromyalgia in this population was 6.4%. Another analysis of 1990, 2010, and modified 2010 ACR criteria from the was done to determine the prevalence of fibromyalgia in the general population. The purpose of this study was to estimate the prevalence of fibromyalgia in general population and examine variations in frequency using different criteria. So through online questionnaires with question on pain, symptoms, and neurological diagnosis, a cross-sectional survey was carried out. Scotland's Northeast has 4,600 adults. Samples of those who meet the criteria and some other persons with associated symptoms were taken for the study. An additional questionnaire was designed for the examination of these participants. So, using the American College of Rheumatology 1990 categorization, the clinical diagnosis of fibromyalgia can be made with or without ruling out the total number of tender points according to the rules which were examined and accepted by the board members without any conflicts of interest. Another researcher looked at several aspects associated to prevalence, symptoms, and attitudes, as well as existence of various symptoms in men and women who complained of having fibromyalgia. The objective of this study was to determine the most effective method for treating fibromyalgia clinically. 28 publications were ultimately chosen based on the inclusion criteria, which included case studies, clinical trials, descriptives, observational, retrospective, prospective studies out of a total of 257 articles that were extracted. The physical activity levels were still low in both men and women, and the manual treatment approach has been effective in reducing pain. The limitations of this study, the data was included from a very limited country. This can affect the actual findings of the prevalence of fibromyalgia. Thereafter, further review is recommended from a big data source. Also, the relationship of psychological components can be further seen in other studies to see their direct effects on the patients with fibromyalgia. Conclusions. It has been cleared with this review that there is a prevalence of fibromyalgia, but as the classification for the diagnostic criteria in the examination is not yet evident. This condition, with many other comorbidities, remain underdiagnosed or misdiagnosed with the other pathologies. The literature review update still needs to set and include some additional associated symptoms along with fibromyalgia so that the prevalence of this illness can be further and thoroughly examined. It has been observed that fibromyalgia prevalence can be seen in a population of any age and gender. According to the numerous research, the prevalence of fibromyalgia is much higher in a female population than the male population. This study concludes that some futuristic studies can be performed with much more defined inclusion and exclusion criteria, where gender effect can be nullified and the actual prevalence of fibromyalgia can be identified with the utilization of some more qualitative tools for assessment. So coming to the funding, so there was no specific grant was given to this particular research from any organization, public, private, or nonprofit, and there was no conflict of interest. These are some of the references. Thank you.